Good afternoon to one and all. I'm Dr. Saket, consultant interventional cardiologist working at Srikara Hospital, RTC Crossroads. So, when does a patient require angioplasty with stenting? Nowadays, cardiologists have been seeing beyond an angiogram, which is a luminogram showing two-dimensional structure of the coronary arteries. Sometimes we come across situations where the block seems to be around 50 to 70%. In those cases, we are faced with a diagnostic dilemma and a therapeutic dilemma where we have to take a call between putting a stent or to leave the lesion unaddressed on medical management. Now, we have various investigations, invasive investigations, which help us to take a call in the cath lab itself to decide whether stenting is necessary in these kind of patients or we can leave those lesions on medical management. So we have two types of evaluations in the cath lab, invasive evaluations. One sees the morphological aspects of the lesion by doing OCT, that is optical coherence tomography, and IVUS, that is intravascular ultrasound, which sees the lesion severity, the characteristic of the lesion being calcified, non-calcified, thrombotic, fibrotic, these kind of lesions. There is something called as susceptible plaques or unstable plaques, which can lead to future acute coronary events if not addressed. So these kind of lesions can be evaluated morphologically in the cath lab itself, and even a lesion which appears to be 50 to 70% blocked in case of an angiogram, after doing these investigations, if we find that the lesion is an unstable plaque or a susceptible plaque, we need to take a call for putting a stent and doing an angioplasty to these kind of patients to prevent any kind of future heart attacks. Second type of analysis is we see the hemodynamic evaluation where we use FFR and IFR. These are fractional flow reserve kind of investigations which help us to determine the severity of the lesion, whether this 50 to 70% looking lesion is really significant enough to cause a decrease in blood flow to the heart muscle, and is it causing the symptoms to the patient. So these are the two modalities where we can confirm the severity of a borderline or intermediate appearing lesion and take a call for doing angioplasty with stenting. Right, thank you.
అద్భుతమైన ఆరోగ్య వీడియోల కోసం 3TV హెల్త్ ఛానల్ ని లైక్ చేయండి, కామెంట్ చేయండి, సబ్స్క్రైబ్ చేయండి, అలాగే షేర్ చేయండి. థాంక్యూ.